Hi, Stefan Hartman here, Iron Direct Primary Care. I'm bringing you a lecture on sauna therapy inside the Traditional Barrel Sauna we have here at the Human Performance Arena at Iron Direct Primary Care. So we're going to go through some of the literature here, and I'm hopefully going to be able to project it up here onto the wall so that we can watch it all and read the lecture together on YouTube. So we're going to start with sauna and the cardiovascular benefits. And that's one of the primary reasons I purchased this sauna. It's because sauna bathing is associated with reduced cardiovascular mortality and improves risk prediction in men and women. I've seen some studies showing that it reduces cardiovascular mortality by half. Now, a lot of these studies are performed in Scandinavia by Luukkanen, and Luukkanen studied the traditional barrel sauna, so not on red light exposure saunas. What he has found is that it's dose dependent. Men who use the sauna roughly twice as often, about 4 to 7 times per week, experienced roughly twice the benefit and were 50% less likely to die from cardiovascular related causes. So that's pretty cool. In the general male Caucasian population, the combined effect of high aerobic fitness and frequent sauna baths is associated with a substantially lower risk of future sudden cardiac death compared with just aerobic fitness or frequent sauna bathing alone. So that's why we have here the resistance training part. We have a gym at the Human Performance Arena in an outdoor setting under the sunlight on a green turf. So you can do the sauna, you can do your resistance training to get the benefits like this study showed. Again, by Luukkanen in 2018. Let's move on to some other disease topics. Sauna bathing reduces the risk of respiratory diseases, a long-term prospective cohort study. This found that sauna bathing has been linked to numerous health benefits, but sauna bathing may reduce the risk of respiratory diseases. So that's something that's it's in folk medicine in Europe. It's well known that, or at least in folk culture, that sauna bathing and cold exposure reduces the risk of respiratory illness or the rate of respiratory illnesses, and may even be curative against them in the acute setting. But now we have literature to suggest this as well. Sauna to protect against dementia. So this was a prospective cohort study conducted on 13,900 men and women, aged 30 to 69, and free from dementia diagnosis in the Finnish Mobile Clinic Follow-Up Survey, follow-up for 39 years. The hazard ratio of dementia between individuals sauna bathing 9 to 12 times per month in comparison with those not sauna bathing or sauna bathing less than 4 times per month was 0.47 during the first 20 years of follow-up. The results are in line with the hypothesis that sauna bathing provides protection against dementia. Sauna to treat chronic fatigue syndrome. So the effects of repeated thermal therapy for 2 patients with chronic fatigue syndrome. This was a case report on 2 patients, and they found that repeated sauna therapy is a promising method to treat those with chronic fatigue syndrome. Sauna to improve immune health. So regular sauna bathing and the incidence of common colds. So everyone gets a common cold, right? Once a year at least, or more in some cases. But sauna bathing can reduce the incidence of cold-like illnesses. So this was one of the few studies that used far infrared sauna treatment. The design was a sequential longitudinal interrupted time series design study. It may be associated with improved quality of life in people with type 2 diabetes mellitus. Uptake of infrared saunas use is greater when the uptake of other lifestyle interventions. So it seems to be a cumulative effect. So sauna to increase performance and immune system. So of course we're interested in improving our performance. So high performance runners sat in a sauna at 85 degrees for half an hour after each training session for 3 weeks. That must be Celsius because that's too cold otherwise. We're sitting here in 170 to 190 degrees Fahrenheit. Relative to control, sauna bathing increased runtime exhaustion by 32%, which is equivalent to an enhancement of approximately 1.9% in an endurance time trial. Sauna increases plasma volume. What this means is that sauna use over weeks is similar to taking EPO, erythropoietin. This is something that Lance Armstrong used to enhance his blood volume. EPO is illegal, but sauna is not illegal in sport competitions. Monocytes and neutrophils represent the body's first line of immune defense against contagious microorganisms, are involved in the inflammatory process and post-exercise muscle damage. Physical exercise might promote phagocytic activity of neutrophils and monocytes, while glucocorticoids cause neutrophilia, eosinophilia, and lymphopenia, and have suppressive effects on natural killer cells. What was that? That was a rock? Don't touch that. It is too hot. So sauna for the non-athlete and risks. So whole body heat stress stimulates the sympathetic nervous system and led to some of the physiologic responses that have been observed with exercise. So this is pretty cool. That essentially means if you have someone who can't exercise for some reason or another, right? Maybe they're repairing a surgery or something like that. You can put them in the sauna and they get similar benefits to exercise, resistance training. So that would be autophagy, which is enhanced cellular turnover, improved immune system. So we can use sauna for those who are deconditioned, who can't train, etc. Effective a single finish sauna session on white blood cell profiles and cortisol levels in athletes and non-athletes. I think this was specifically done on runners, and that's because runners, actually, the endurance runners, long distance runners, it causes immunosuppression, so it suppresses their immune system. So the following conclusions can be drawn based on results of this study. Sauna bathing with a body cool down causes a significant increase in overall white blood cell count only in the group of trained men. Sauna bathing considerably elevates neutrophil count, basophil count, and lymphocyte count in the blood of trained men. Sauna bathing causes a significantly higher increase in white blood cell and monocytes in athletes compared to untrained subject. Changes in the white blood cell profile suggest a faster mobilization of cells in the first line of immune defense in athletes compared to untrained athletes after sauna bathing sessions. Sauna bathing could be recommended for athletes as a means of enhancing immunological defense. And I think this really applies to those endurance runners. We're going to move into detoxification, which is quite the buzzword. But yes, sauna is one of the few things that actually detoxes the body, and it eliminates toxins. So let's talk about arsenic, cadmium, lead, and mercury in sweat, a systematic review. So these are heavy metals. They're toxic to the human body, and they are excreted in appreciable quantities through the skin. And the rates of excretion were reported to match or even exceed urinary excretion in 24-hour period. In individuals with higher exposure or body burden, sweat generally exceeded plasma or urine concentrates, and dermal could match or surpass urinary daily excretion. Arsenic dermal excretion was several-fold higher in arsenic-exposed individuals than in unexposed controls. Cadmium was more concentrated in sweat than in blood plasma. Sweat lead was associated with high molecular weight molecules, and in an interventional study, levels were higher with endurance compared with intensive exercise. Mercury levels normalized with repeated saunas in case report. Now let's talk about one of my favorite studies to describe how the benefits of sauna therapy, and it's the METHCOPS study. So this is methamphetamine exposure and chronic illness in police officers. And they significantly improved in all categories with this detox protocol. So the treatment process consisted of 20 to 30 minutes of aerobic exercise, 2 comprehensive nutritional supplementation, including increasing doses of niacin, and moderate temperature sauna therapy, with breaks every 30 minutes for fluid and electrolyte restoration, totaling about 4 hours daily. Treatment is given each day until maximum gains are achieved, typically 4 to 6 weeks. Heat source was pretty hot, so exactly actually this sauna, which is 15,000 watts, 240 volts, in a ceramic coil surrounded by granite stones, maintaining a stable 160 degrees Fahrenheit at 5 foot above the sauna floor. So that's exactly what this is. The study data suggests that thyroid and androgen dysfunction and neurotoxic effects may appropriately be assessed. Those with chronic symptoms may benefit from treatment programs, such as this one, that have been shown to improve health and reduce residual pollutant chemical burden. There's a cool graph that I'm going to put up here on the wall that has showed that these cops had all sorts of chronic conditions, chronic pain, fatigue, depression, uh, endocrine dysfunction. These metals cause a whole host of problems for them. And the interesting thing is using niacin for this. So enhancing the metal detoxification through sauna, there's a couple things that you can do. This study suggests you can use N-acetylcysteine, vitamin C as a chelating agents, and low doses of ethanol, so that's the alcohol, for mercury. I like the niacin because it's healthier than alcohol use. It opens up the capillaries, helps you get more of a sweat. But I always start really low with niacin, 25 milligrams, because you're going to flush and you're going to feel kind of miserable at that. You work your way up as tolerated. I think up to about 3 grams might be a decent dose for that. So let's talk about traditional sauna as per Dr. Rhonda Patrick, who's put up a lot of good literature on sauna therapies. So humidity, which this sauna can perform steam therapy as well. You can pour water on the rocks there. So saunas can be either dry or wet. In a dry sauna, the relative humidity is low, 10 to 20%. A common practice in Finland called iolil is to throw water on the heater rocks to increase humidity slightly. The term wet sauna is a misnomer, however, referring to a steam sauna where the humidity is extremely high, typically greater than 50%, which keeps sweat from evaporating. A wet sauna may feel subjectively hotter than a dry sauna and is harder on the cardiovascular system due to reduced evaporative cooling. So let's talk about duration and temperature. Finnish-style sauna bathing, which is what we have here, involves 1 to 3 sessions of heat exposure lasting 5 to 20 minutes each, interspersed with periods of cooling. Some cooling methods can be rather extreme and involve rolling in the snow or immersing in cold water, which further stresses the cardiovascular system. Sauna poses little risk of cardiovascular complications in healthy people. Studies have found that a dose-dependent reduction in cardiovascular mortality and all-cause mortality and Alzheimer's disease incidence typically involves saunas that were heated to a temperature of at least 174 degrees Fahrenheit for at least 20 minutes. In fact, these studies found that the amount of time spent in the sauna also affected cardiovascular-related mortalities, with a longer duration of 19 minutes or more having a more robust effect than 11 to 18 minutes on lowering mortality rate. So it seems like what we have here, we can crank this thing up easily to 174 degrees Fahrenheit, and then spending about 20 minutes or 15 to 20 minutes in here is probably enough to reduce your cardiovascular risk. Let's see. During sauna use or moderate exercise, the participant's heart rate and blood pressure increases immediately. But after the sauna or exercise session, participants' blood pressure and heart rate begin to drop below baseline levels measured pre-sauna or exercise. Like exercise, long-term sauna usually generates improvement in blood pressure, endothelial function, and left ventricular function, and reduces inflammation. Central to the pathophysiology of hypertension is a loss of arterial compliance or elasticity, which can have far-reaching effects on multiple organ systems, including brain and kidneys. A common element among sauna users, however, is lower incidence in hypertension through improvements in arterial compliance. For example, men who use the sauna 2 to 3 sessions every week were found to have 24% lower risk of developing hypertension, and men who use the sauna 4 to 7 times per week had a 46% lower risk of hypertension compared to men who use the sauna only once per week. But just a single sauna session has been shown to lower blood pressure and improve arterial compliance. As such, sauna use may serve as a non-pharmacological means to address or even prevent hypertension, which is what we're all about here, using natural means to treat conventional diseases. Well, let's talk about some pretty advanced disease states here: ischemic heart disease and peripheral artery disease. Ischemic heart disease is also known as CAD, coronary artery disease. It's characterized by a reduced blood supply to the heart It is the most common cause of death in most Western countries. A randomized controlled trial examined the effects of sauna use in 24 patients with ischemic heart disease with chronic total coronary artery occlusion, full blockage of one or more arteries that supply the heart, who had not responded to non-surgical procedures and were not candidates for surgical interventions. The findings demonstrated that 15 sessions given over a 3-week period improved patients' vascular endothelial function. No improvements were observed in the control group that received standard medical care. Okay. Peripheral artery disease, PAD, is a painful and debilitating condition in which the arteries that supply the head and extremities narrow. A pilot trial involving 20 patients with PAD who received 50 sessions over a period of 10 weeks demonstrated improvements in pain levels, walking endurance, and lower extremity blood flow. A similar randomized controlled trial involving 21 patients with PAD showed comparable improvements. Let's talk about insulin and glucose. So, interesting, repeated exposure to the whole body heat treatment through sauna use has an even more profound effect on boosting growth hormone immediately afterwards. 17 men and women who were exposed to two 1-hour sauna sessions at 176 Fahrenheit dry heat, typical Finnish style sauna, per day for 7 days exhibited a 16-fold increase in growth hormone levels by the 3rd day. The growth hormone effects generally persisted for a few hours post-sauna. It is noteworthy, however, that sauna use and exercise can synergize to significantly elevate growth hormone when used together. The two 20-minute sauna sessions involving 176 Fahrenheit, separated by a 30-minute cooling down period, elevated growth hormone levels twofold over baseline, and two 15-minute sessions at 212 degrees Fahrenheit dry heat resulted in a 5-fold increase in growth hormone. So we'd have to crank this up to 212. We can do that. So, dysfunction of the heart's left ventricle sets in motion a cascade of compensatory mechanisms that promote organ-level structural changes and elicit system-level hormonal adaptations. It is widely recognized as end stage of heart failure. Both single session and long-term, that means 5 days per week for 4 weeks sauna use, improved ventricular function in men with congestive heart failure and may have therapeutic value for treating late-stage cardiovascular disease. Let's talk about inflammation. Sauna use reduces blood CRP levels. In a study of more than 2,000 men living in Finland, CRP levels were inversely related to the frequency of sauna bathing in a dose-response fashion, with lower levels linked to greater frequency. As described above, IL-10 is a potent endogenous anti-inflammatory protein. A study involving 22 healthy male athletes and non-athletes who received two 15-minute sauna sessions at 208 degrees Fahrenheit, separated by a 5-minute cool shower, the men's resting IL-10 levels increased and the adaptation occurred faster in athletes. So some warnings per Dr. Rhonda Patrick. Hydration and electrolytes. We do have electrolytes for purchase here at Iron DPC for members. Proper hydration and electrolyte balance are critical to maintain the body's fluid balance and promote normal muscle contractility and nerve function. As described above, the average person loses approximately 0.5 kilograms of fluid as sweat during a single sauna session. And alcohol use before or after sauna can cause further problems. Pregnancy observational studies conducted in Finland and the United States showed no link between sauna use and higher incidence of cardiovascular malformations, the most common form of birth defects. Children, it should be safe. However, we don't allow children younger than 14 or pregnant women to use the sauna here at the Human Performance Arena. People who are ill or taking medications, so those with acute illness accompanied by fever or inflammatory skin conditions should avoid sauna use. People taking any kind of medication, whether prescribed or over the counter, should really talk to their clinician before sauna use. Several studies have shown that people with certain types of cardiovascular disease may experience improvements in their symptoms and disease status with sauna use. So obviously, if you're taking blood pressure medications at your regular dose and you use sauna use and you lose some electrolytes, your blood pressure decreases, it may be too much, and you may pass out from low blood pressure. So, summary of evidence for sauna. Sauna is an ancient practice that's been in use since Roman, Greek times, Ottoman Empire times. Recent studies have shown applications for treating modern diseases and chronic diseases. Sauna appears to boost the immune system. It decreases the risk of cardiovascular morbidity and mortality. Disease in Alzheimer's decreases with increased use of sauna. Sauna boosts the immune system and decreases incidence of respiratory infections. Sauna detoxifies. Is one of the few real detox methods for heavy metals and drug intoxications. It enhances an athlete's performance with regular use. It improves the endocrine system. It boosts HGH, human growth hormone. It enhances epidermal perfusion and vasodilation, especially when combined with niacin. And it may help treat more chronic illnesses, chronic fatigue syndrome, etc. And that's all we have for today. I'm going to go take a shower and get in the cold plunge because that was hot. And I'm going to drink some electrolytes.